Hi everyone, my name is Dr. Sockanathan. I am a family medicine physician and I'm a part of the Healthy Living Center at the Center for Community Health and Prevention. I'm here today to talk a bit about how we can help teens understand the risks of vaping. I'll start first by talking a little bit about nicotine. As we all know, nicotine is an ingredient in traditional cigarettes. It's actually present in most vaping products as well. Nicotine increases the amount of dopamine released in our brain, and that really leads to a feeling of satisfaction, a feeling of reward, and this feeling is what ultimately leads to nicotine dependence and addiction. Folks who smoke e-cigarettes are often at risk for reaching for other forms of nicotine, such as traditional cigarettes. So it's actually been shown that e-cigarette users are 7 times more likely to start smoking traditional cigarettes. Another important point I wanted to make was that nicotine in vapes can actually worsen anxiety and depression. This is important to note because I think a lot of people reach for vaping as a means to improve their anxiety and their mood. And many people feel that in the moment it really does help with that. However, in the long term, it has been shown to worsen anxiety and depression. I think it's important to compare e-cigarettes and cigarettes. Many people believe that e-cigarettes are a safer alternative to cigarettes. And that's really, it's been marketed that way and it's in the media. So I think people have reason to believe that, but I'm here to tell you that that is not the case. E-cigarettes, we're still learning a lot about them, but from what we know, it's definitely not a safe alternative. And in some cases, actually, the e-cigarettes can emit higher levels of certain metals than traditional cigarettes. The emissions of e-cigarettes actually contain chemicals like formaldehyde and acetaldehyde, and those chemicals are the same ones that are found in cigarette smoke as well. We all know that traditional cigarettes are associated with poor health risks, poor health outcomes, particularly when we talk about your heart health, cardiovascular health. It's actually been found that e-cigarettes can cause similar negative outcomes as well. So e-cigarettes can actually cause changes in our blood vessels throughout our body in a similar way as traditional cigarettes. Other ingredients that are found in vapes are diacetyl. When inhaled, this can actually lead to bronchiolitis obliterans. Another term for that is popcorn lung that many people may have heard of. Propylene glycol is another ingredient, and this is what actually can turn into formaldehyde when the vape is heated up. And formaldehyde is a known carcinogen, so it can increase the risks of certain cancers. Lead has also been found to be an ingredient in many vapes. We all know about the risks of lead in multiple aspects of our health, and we regulate that in a lot of household products and paint, but vapes are unfortunately a common way that homes are being exposed to lead now. So what can we do to help? Here at the Healthy Living Center, we have a few options to help teens and really anyone of all ages really work on their addiction to nicotine and vaping. We offer individual appointments to help you understand what these risks are and hopefully minimize your vaping. Sometimes counseling alone is sufficient during these visits. Other times prescriptions can be considered as well. There are group sessions that are available specifically for teens that are interested in working on this. Vape Escape is the name of the program for the group sessions, and there are virtual options for these as well. Our team here at the Healthy Living Center is an interdisciplinary team. We have medical doctors, nurse practitioner, lifestyle counselors. So we really all work together to figure out what the best way to help you. So definitely reach out if you're interested in any of these methods or just want to learn more information.